Why your filler results don't last. You had filler done. It looked good. And then a few months later, it's gone. So the question is, did the filler dissolve? Or was it never placed correctly to begin with? It's not just about the product. Different fillers have different properties and longevity. But even long-lasting fillers will appear to disappear if placed incorrectly. Blaming the product alone oversimplifies the problem. Technique plays a much bigger role than most realize. Depth of injection matters. If filler is placed too superficially, it is more noticeable initially but less stable. It is more prone to movement and faster breakdown. Deeper placement, when appropriate, provides structural support and longer-lasting results. Incorrect depth is one of the most common reasons results don't last. Placement and anatomy. Filler should be placed based on underlying anatomy, not just the visible defect. For example, treating the tear trough without addressing midface support often fails. If the foundation is not corrected, the result is temporary. Good outcomes depend on correct anatomical planning. Movement and dynamic areas. Areas with high movement, lips, perioral region, tend to break down filler faster. Muscle activity and mechanical forces affect longevity. Even with good technique, these areas may not last as long. This needs to be explained to patients. Lymphatics and fluid balance. Filler interacts with surrounding tissue and fluid dynamics. In areas like the tear trough, poor placement can disrupt lymphatic drainage. This can cause swelling, masking the true result. Over time, this leads to unpredictable outcomes. Product integration versus dissolution. Filler does not simply disappear. It integrates with tissue, redistributes, or in some cases migrates. What patients perceive as loss may actually be spread or reduced projection. This is why results appear to fade even when filler is still present. Overcorrection versus undercorrection. Undercorrection may look good initially but lacks durability. Overcorrection may last longer but risks unnatural results. The goal is balanced, anatomically correct placement, not volume alone. Common practitioner mistakes. Treating the visible problem without addressing structure. Incorrect depth or plane of injection. Using the wrong product for the area. Repeating treatment instead of reassessing strategy. Patient factors. Metabolism, lifestyle, and skin quality all influence outcomes. Exercise, inflammation, and aging changes can affect longevity. But these are secondary. Technique remains the primary factor. What actually improves longevity? Correct anatomical assessment, appropriate depth and placement, choosing the right product for the indication, treating structural support, not just surface defects, setting realistic expectations. What actually improves longevity? Correct anatomical assessment, appropriate depth and placement, choosing the right product for the indication, treating structural support, not just surface defects, setting realistic expectations. Conclusion. If your filler results don't last, the problem is usually not the filler itself. It's how, where, and why it was placed. Because in aesthetic medicine, longevity is not just about time. It's about technique. Thank you for watching. If you found this video useful, please hit the like button, leave a comment below, and subscribe for more expert content. Feel free to share this with your colleagues and peers.